Could steroids be the reason behind your gynecomastia? In this video, I'll tell you everything you need to know to recognize and address this issue. How do steroids cause gynecomastia? First, steroid can affect the hormone balance in the body. So it can increase the estrogen and can suppress the testosterone, and the increase of the estrogen level in the body can enhance the growth of the chest or the breast tissue. So which steroids are most likely to cause gynecomastia? So first, there are the anabolic steroids. Anabolic steroids, which include testosterone and its derivatives. Next is progestin-based hormones and also aromatizable steroids. And finally, the synthetic steroids. These type of steroids can induce gynecomastia because of the lack of estrogen control and as well as the prolonged use of these steroids with high doses. So what are the symptoms of steroid-induced gynecomastia? Most common symptoms are increased sensitivity in the nipple, discomfort, sensation of swelling, heaviness in the chest area, swelling in the chest, itching of the skin or in the nipple, and as well as a visible increase in the volume of the tissue in the area. The appearance of gynecomastia often makes patients to feel self-conscious about it, especially if it becomes visible and if it attracts attention. Who is more likely to develop gynecomastia from use of steroid? So people are more likely to develop gynecomastia after they use steroid are those who have pre-existing hormone imbalances. So extreme ages, very young patients in their teenage, often they have changes in their hormone, and adding the steroid that is likely to make these imbalances worse. And also older patients and they're after middle age, also they can have usually low testosterone levels. So introducing steroid can also cause more imbalance and increase of the estrogen level. Other factors could be genetic. There are people genetically more predisposed to get gynecomastia from steroid use, and definitely those people who use the steroid for a prolonged period of time and with higher doses are also more prone to develop gynecomastia. How do you prevent gynecomastia when using steroid? So the best way to avoid gynecomastia is, in these cases, is to stop the use of steroid altogether. However, if this is something you're not willing to accept, then you should be very vigilant to any symptoms which you have, and as soon as you get symptoms of gynecomastia, you should stop the use of steroid. If you decide to continue the use of steroid, so I strongly recommend you seek an expert medical opinion. So an endocrinologist, a doctor who have specialized in the hormones will be able to guide you best in terms of which are the safest or least side effect type of steroids or hormones. What are the treatment options for steroid-induced gynecomastia? So treatment starts by first stop the steroids, stopping the cause of the gynecomastia. Secondly, there are non-surgical options which involve some medication which inhibits or reduces the effect of estrogen, such as tamoxifen and anti-estrogen medications. And these need to be guided with a medical profession to prescribe it and to keep monitoring the situation. These are non-medical. Next is surgical options to deal with the gynecomastia, and that could involve either liposuction to reduce any fatty component of the gynecomastia, or an open excision by cutting and physically removing of the gland tissue. And we often do a combination surgery where we do combined liposuction with open excision of the gland. What are the risks of ignoring gynecomastia symptoms? So if you ignore your gynecomastia symptoms, it's not going to go away on its own. You need to have it checked, and if you're taking steroid, the first step is to stop these steroids. Seeking medical opinion, because the gynecomastia could also be caused by other factors other than using steroids. Could be related to medication, sometimes related to hormone imbalances in the body, or completely unrelated to the use of steroids. So it's important to check the cause. Other reason for increased volume in the chest could be tumors as well, even though they are very rare, but The risk of breast cancer in men is about 1% of total breast cancer. So that's something which you need to be checked. So it's very important not to ignore it and seek professional advice.